Hi, I'm Avery, and I'm going to take you through arteries 111 through 129. First, we have 111, which is the common carotid artery. This is the major artery that ascends the neck and splits it into the internal and external carotid arteries to supply the head and neck. Next, we have 113, which is the internal carotid artery, and this is the artery that supplies oxygenated blood to the brain, eyes, and other intracranial structures. Number 118 is the lingual artery, and this is a branch of external carotid artery that supplies blood to the tongue and floor of the mouth. Number 119 is the facial artery, and this is a major branch of the external carotid artery that supplies blood to the face, lips, nose, and surrounding facial structures. Number 120 is the ascending palatine artery, and this is a branch of the facial artery that supplies the soft palate, tonsils, and pharyngeal region. Number 121 is the submental artery, and this is a branch of the facial artery that supplies the chin, lower lip, and floor of the mouth. Number 122 is the inferior labial artery, and this is a branch of the facial artery that supplies blood to the lower lip. Number 123 is the superior labial artery, and this is a branch of facial artery that supplies blood to the upper lip and nasal septum. Number 124 is the angular artery, and this is the terminal branch of the facial artery that supplies the side of the nose and medial corner of the eye. Number 125 is the occipital artery, and this is a branch of the external carotid artery that supplies blood to the posterior scalp and muscles of the neck. 26 is the posterior auricular artery, and this is a branch of the external carotid artery that supplies the ear and the scalp behind the ear. Number 127 is the maxillary artery, and this is a large terminal branch of the external carotid artery that supplies deep facial structure. Number 128 is the middle meningeal artery, and this is a branch of the maxillary artery that supplies the dura mater in the skull. Number 129 is the inferior alveolar artery, and this is a branch of the maxillary artery that enters the mandibular foramen to supply the mandibular teeth and jaw.
Hi, I'm Courtney, and I will be doing numbers 130 through 143 on this part of our school project. First up, on the inside of the mandible, we have number 130, the mylohyoid artery. The mylohyoid artery is a branch of the inferior alveolar artery, and it supplies blood to the mylohyoid muscle in the floor of the mouth. Next, we have number 131, the mental artery. This is another branch of the inferior alveolar artery, and it exits through the mental foramen and supplies blood to the chin, lower lip, and surrounding tissues. Again, on the inside of the mandible, we have number 132, the incisive artery. The incisive artery continues forward within the mandible and supplies the anterior teeth and surrounding bone. Next up, we have number 133, the masseteric artery. The masseteric artery supplies blood to the masseter muscle, which is involved in chewing. Number 134, the pterygoid artery, supplies the medial and lateral pterygoid muscles that help with jaw movement. Number 135, the deep temporal artery, supplies the temporalis muscle, which is another major muscle used for chewing. Number 136, the buccal artery, supplies the buccinator muscle in the cheek area. Number 137, the posterior superior alveolar artery, otherwise known as the PSA, supplies the maxillary molars, the surrounding bone, and the gingiva. Number 138, the descending palatine artery, travels downward to supply the palate. Number 139, the greater palatine artery. The branch supplies the hard palate and the palatal gingiva. Right next to it, we have number 140, the lesser palatine artery. This supplies the soft palate and the surrounding tissues. Number 141, the infraorbital artery. This artery travels through the infraorbital foramen and supplies the lower eyelid, upper lip, and part of the face. Number 142, the anterior superior alveolar artery, otherwise known as the ASA. This artery supplies the maxillary incisors and canine teeth as well as the surrounding tissues. Number 143, the middle superior alveolar artery, also known as the MSA. This artery supplies the maxillary premolars and the surrounding bone and gingiva.
Hi, my name is Kelsey. I'll be covering numbers 144 through 156. Number 144 is all the way up and tucked in the sphenopalatine bone. It's the sphenopalatine artery. It supplies the blood to the nasal cavity, nasal septum, and lateral nasal wall, helping to nourish the mucosa and structures of the posterior nasal cavity. 145 is the nasopalatine artery, which supplies the anterior hard palate and palatal gingiva behind the maxillary incisors, providing oxygenated blood to the palatal tissues. Number 146 is the superficial temporal artery, which supplies the scalp, temporalis muscle, and surrounding temporal region. Number 147 comes across the zygomatic bone. It's the transverse facial artery. It supplies the parotid gland, masseter muscle, and facial tissues across the cheek, supporting blood flow to the lateral of the face. Number 148 is a branch off the superficial temporal artery. It's the middle temporal artery, which supplies the temporalis muscle and temporal fascia, providing blood needed for muscle function during mastification. Number 149 is also a branch off the superficial. It's the frontal branch. It supplies the frontal scalp and forehead region, nourishing tissues and muscles of the anterior scalp. 150 right next door is the parietal branch of the superficial temporal artery, which supplies the parietal region of the scalp, providing oxygenated blood to the posterior lateral scalp tissues. Ignore the damage from spring break transit. 151 is the internal jugular vein, which drains blood from the brain, face, and neck and carries deoxygenated blood back to the heart. 152 spans across most of the face. It's the facial vein. It drains blood from the facial structures along the mandible, including nearby muscles and skin of the lower face. Number 153 can be seen from the inferior view of the skull. It's the submental vein, which drains the chin, lower lip region, and mylohyoid area, returning deoxygenated blood from the submental region. Number 154 is the inferior labial vein, which drains blood from the lower lip and surrounding muscles such as the albicularis oris. 155 is right above. It's the superior labial vein, which drains blood from the upper lip and associated muscles of facial expression. Number 156 is the angular vein, which drains blood from the medial eye region, nose, and upper face where facial and ophthalmic venous systems connect.
Hi, I'm Olivia, here's my skull, and today I'm going to be going over numbers 157 through 171 of part 4 of the skull project.
157 is a supraorbital vein, which is a vein on the forehead that drains the blood from the scalp and forehead region and typically joins the angular vein near the eye. 158 is the ophthalmic vein, which drains venous sinus blood from the eye and orbit and usually empties into the cavernous sinus inside the skull. The lingual vein, number 159, drains blood from the tongue and floor of the mouth and typically empties into the internal jugular vein. Number 161 is the cavernous venous sinus, and it's a large venous channel located on either side of the stella tertia that drains blood from the brain and face. Number 162, the PSA vein, or posterior superior alveolar vein, drains blood from the maxillary molar teeth and surrounding structures and empties it into the pterygoid venous plexus. The pterygoid venous plexus is a network of veins in the infratemporal region that drains blood from deep face structures and communicates with the maxillary vein and the cavernous sinus. Number 164 is the maxillary vein, which collects blood from deep facial region and joins the superficial temporal vein to form the retromandibular vein. Number 165, the inferior alveolar vein, drains blood from the mandibular teeth and surrounding tissues and empties it into the pterygoid venous plexus. Number 166, the mental vein, drains blood from the chin and lower lip and empties it into the inferior alveolar vein. Number 167, the superficial temporal vein, drains blood from the scalp and temporal region and joins the maxillary vein to form the retromandibular vein. The retromandibular vein is formed by the union of the superficial temporal vein and the maxillary vein and helps drain the blood from both of those regions. 171 is the external jugular vein, which drains blood from the face and scalp and empties into the subclavian vein.